Good morning, and this morning we are here again at 1524 La Vista Drive, Decatur, Georgia, United States of America, and we are continuing with our hematologic disorder, and at this time we are on the condition of leukocytosis. Leukocytosis. Once again, I'm yours truly, Dolphy Gilpin, and we're continuing now leukocytosis. Leukocytosis is an elevation in the leukocyte count in the blood. Leukocytes are white blood cells. You see here WBC. Now, in leukocytosis, leukocytosis can be found in mothers that just have in babies. Leukocytosis is also seen in marathon runners. After they run a marathon race, that we have this elevation in white blood cells. And it's also seen as a sign of mental stress. When you go through stress, then you have this elevation in the white blood cells. So in general, it's an increase in the number of white blood cells. 5 types of leukocytosis will be dealt with here. And this will be dealt with in the term of white blood cells. There are 5 types that we are focusing on, which are 1, the basophils, and the condition of increased number of basophils called the condition basophilia, which is an elevation in the number of basophils in the blood. Now, basophilia acts at inflammatory sites. And what they do, they carry this substance heparin and histoamine or histamine to the site of the inflammation. Or to the site of the infection. And this infection can include like psoriasis, rheumatoid arthritis, irritable bowel disease, IBD, I call that now. Irritable bowel disease, and some other bone marrow disease. Yeah, so condition of basophilia. The basophilia levels are increased, and they carry these substances like heparin and histamine to the inflammatory or infection site. And some of these infections can include psoriasis, rheumatoid arthritis, irritable bowel disease, and bone marrow disease. And if the condition of basophilia is unclear, then we could go on and we can do what we call a bone marrow test. or genetic tests, or genetic testing. That is if the condition of the basophilia is unclear. All right, so we move on now to the second form of leukocytosis, which is now eosinophilia. And this is an increase in the number of eosinophils or eosinophils. So the eosinophils, the increase or the elevation in these eosinophils is a sign of leukocytosis. And there are two types. You could have eosinophils in the tissue and eosinophils in the blood. So we could have tissue and blood, the elevation of the eosinophils. Once again, the case of eosinophilia, it regulates inflammation, like the basophils. It regulates inflammation. And it helps to break down foreign substance in the body, such as parasites. It helps now to break down foreign substance e.g. parasites. All right, so we have the case of eosinophilia again, and we say that it also helps to regulate inflammation. It helps to break down foreign substance in the body, such as parasites. So what will it do to these parasites? It helps to destroy the parasites. So the third case of now leukocytosis we're looking at now would be neutrophilia. And this would be an increase now in the number of neutrophils. And we say now that in neutrophilia, which is an increase or elevation in number of neutrophils, which is a form of leukocytosis, that this is the most common form of leukocytosis and a common or main form of leukocytosis. And these neutrophils attack bacterial infections. Yeah, so they attack bacterial infection. And these are dead neutrophils are found in pyrogenic injuries, like when you get an injuries and then you develop this pus, this white sort of pussy fluid. It contains dead neutrophils, so they act at wound site, and then you have the scab coming over the skin. The white pus contains these dead neutrophils. Dead neutrophils in the pus of stale injury. When the injury is in the process of healing, then you have, this pussy thing develop, and the what we call the scab come over the skin, and under it the pus. Now the pus itself contains dead neutrophils, which aid in the process of healing. Now there are two cells that these neutrophils turn into. One is the macrophage, and the other is the dendritic cells. And we know that the macrophages are all-purpose cells that, they are sort of comprehensive. They deal with all form of inflammation, infection,